Something to consider when starting an IV. Each patient is unique with their vein presentations. Some patients have really small veins, so you may not be able to get a 20 gauge in all patients. If the vein looks too small, then go with a smaller needle. Don't be afraid to place a 22 gauge or a 24 gauge needle. They usually work well and they are better than having no IV access, and any IV access is better than no access. When you're ready to insert your needle, keep your eye on the target rather than focusing on the needle tip. While keeping your eye on the target, you will see the needle approach the insertion site and puncture the skin. It's similar to shooting a basketball or throwing darts. You're not watching the basketball or the dart, you're looking at the rim or the bullseye. If you're unsure if you're feeling a tendon or a vein, remove the tourniquet. If there is no change, it is likely a tendon or scar tissue. If the plumpness went away, it was likely a vein. Reapply the tourniquet and check for the return of plumpness. It is sometimes hard to palpate a vein with your gloves on. Removing your glove to feel the vein allows better sensation, especially for difficult sticks. After locating the vein, don gloves before proceeding with needle insertion. Do not remove your gloves if the patient has any condition that would pose a risk to you not wearing gloves. And also remember hand hygiene. Always foam after touching the skin and placing your gloves back on.